and welcome to AgeWise Health. My name is Madeline Didi, and I am your host from AmeriStaff Nursing Services. On today's show, we welcome Dan Hamann of AmeriCare Medical. Hi, Dan. Thanks for being on our show today.
Thanks for having me.
Absolutely. So can we start off by hearing a little bit about your background in HR and introduce yourself a little bit and what you do?
Okay. Well, I'm the Director of Human Resources at AmeriCare Medical. I've been in HR for a lot of years, as you can tell by the gray hair, back when HR didn't have all the technology to help it out. So started out my career actually as a counselor at Walsh College, so it's been about 14 years there. So adjunct faculty as well, and then moved on to the world of public accounting, where I was director of HR for about 22 years. So, and then joined AmeriCare back in January of 24. So it's been, actually in between that, I did spend some time in the veterinary industry. So healthcare, just a different different subject.
Yeah, absolutely. Can you tell me a little bit more about your current role at AmeriCare Medical and what you do there?
Oversee and responsible for the recruiting side of things, obviously, which is a big part of any business in these days. Benefits, training, compensation. So any other issue that other departments either don't want to handle or need some assistance with, it comes to HR. Done some picnic planning and stuff like that, and the fun stuff, as well as putting together new benefit programs.
Yeah, absolutely. So when it comes to, talking about hiring in the healthcare industry, how many employees do you have at AmeriCare Medical in total?
Well, as of an onboarding today, we're a couple shy of 250. So we're large by industry standards for what we do. But it's constantly growing because as the patient's needs and the patient volume grows, we're adapting to that.
Yeah, absolutely. Is that what's the makeup of the employees? Are they all different roles?
Yeah, we have a number of HHAs, or home health aides. We have a number of licensed practical nurses, registered nurses, physical therapists, occupational therapists, any number of there's different levels within those positions, but they are our field staff. They're the ones that are actually doing the work and getting the patient care into the patient's homes.
Absolutely. Sounds like there's a lot of different avenues.
Very much so. And
Yeah.
each case is unique, and that's a nice thing about AmeriCare Medical, is that each case is handled from a different, might be the same set of eyes, but looking at it from every perspective, where this case might need this case might need that. We're able to provide all the resources that any of those cases would need.
Yeah, absolutely. So when it comes to recruiting staff in healthcare today, what are some of the challenges that you find yourself facing with this current environment?
You mean besides the shortages? I think the shortage is probably the biggest issue. Because healthcare and the nature of the work that our home health aides do, our caregivers, it is difficult work. In some cases it might be long shifts. It might be cases that maybe touch a nerve because of personal experience. But the hardest thing is to find the talent that's willing to work hard, but then have a meaningful impact on someone else's life or on their own, because they realize that at the end of the day, they've done something other than just put a sandwich in a box or something like that. They're actually making someone's life better.
Right, absolutely. When it comes to your staff and the important work that they do there, is there any certain awards or accreditations that AmeriCare Medical has been recognized for in their staff that they have there?
Yeah, there's probably the most recognized as the top workplaces in Michigan, and we're very proud of the fact that that's an award that is, I guess, awarded based on employee feedback, employee input. So it doesn't matter how much advertising we do in the world, it's all based on, responses that our employees give. And we've won that for the last 4 consecutive years, 6 years total. COVID was kind of an off year, and I think it impacted a lot of people's consecutive awards. But we're excited about that because it shows that not only do we, respect our employees, but the opportunities and the benefits and just the work environment is something that they're proud of and that we're proud to be able to, offer and to continue to refine.
Right, of course, and that's very important, with staff retention and things of that nature in healthcare.
Yes.
So to look at some of the trends that are in the caregiver industry currently, what are some of the skills that you look for when you're hiring your field staff?
Well, certainly, I mentioned it earlier, the compassion. I mean, they have to look at it as not just a stepping stone. They have to look at it as, as a career, because we've had some of our staff that have started out as a field staff, maybe a home health aide, or maybe just some type of caregiver that have realized this is what I want to do. And then they go to school, then they, go to nursing school, and then they finish that. So it's nice to see, that we might have just kind of help them recognize that they have that desire. But certainly the skills that we're looking for is someone that is, dependable, because if we put someone on a case, we obviously, that caregiver or that patient is dependent upon that person to show up. And then not only does that patient depending upon that, but the other caregiver that there is depending that their relief is going to come. So it's just very, very important that that they're dedicated, committed, responsible, and willing to take initiative. If they see something that needs to be addressed, they can present it to our nursing staff. So they're the eyes and the ears for us because they're going to be with the patient more times than our nursing staff when they do their visits.
Right, absolutely. It sounds like a big job.
It is, and I think a good percentage of our staff have been there for years. I mean, and it's pretty impressive to see that, the relationships that the patients and the families have with these caregivers, and they, it just makes you feel like you're doing something right.
Yeah, absolutely. When you're looking at recruiting and your staffing, are there certain candidates that are more difficult to find than others throughout the healthcare industry?
That's very much a cyclical, for a while we were having issues finding nurses, and that's lightened up a bit. I mean, the nice thing about what we can offer as a nurse, most people think of a nurse when they go to the doctor or the hospital and they see the nurses and they're working their shifts 3 days a week, 4 days. The nurses that we hire, we have some that might work that full time like that, but it's not with the same patient. So, we can provide opportunities for nurses that are maybe looking to pick up a day on the weekend where they can visit some of these patients and earn some extra money without having to be on the floor. The nursing, our ability to fill our nursing roles has gotten better. Right now, it's the physical and occupational therapists. We have a location on the west side of Michigan in Grand Rapids, and then our main location in Troy. So different at different times. It's never the same at both places. But and we like to staff to make sure that we're accommodating the patient's needs too. So there might be some unique skill set that we have to have based on the patient's needs.
Right, absolutely. It sounds, healthcare is always changing, needs of patients are always changing, so
yeah,
that definitely probably has an impact on the recruiting and the staffing.
Sure does.
So when it comes to ensuring quality care with the staff that you work with, how do you guarantee that the caregivers are assigned to a right fit, like a good patient that would work well with, their skill sets, their interests, things of that nature? Well,
we have phenomenal teams at AmeriCare, from the recruiting team to our coordinating team. coordinating team, there's a much more, if you will, patient-facing, are the ones that are working with the case managers to make sure that the shifts are covered, and the recruiting team is obviously recruiting to, to fill those needs. So, we do an intake. The recruiting will start out with doing an intake, going through some questions. We ask the applicants to kind of go through, are you comfortable with pets, cats, dogs, size of dogs, kids in the home? Do you want to work overnights? Do you want to work weekends? How far are you willing to drive from your home? Are you comfortable? What's your experience level? Because it could be someone that just cared for a family member and liked that and thought that, well, let me look into that for more of a career role. Or it could be someone that's, actually licensed as a certified nursing assistant or something else and's got stronger skill sets. And then our coordinating team and our, the people that interact with the patients will determine, what kind of person you're looking for. They know that person, well, that person's outgoing, or they like to chat. So, maybe we want to put someone, that doesn't chat too much because all they'll do is sit around and talk. Or someone that's comfortable helping with some light housekeeping, making a meal or something like that. And depending upon the patient, sometimes they actually have a little meet and greet. It sounds kind of funny, but, you might have, this patient might require 24 hours a day, 7-day-a-week care. You want to make sure that the fit, because they have enough things to worry about based on their situation. They don't want to have the disruption of, constant changes in staff. So
Right.
We spend a lot of time with that. And then once we assign, a caregiver to that patient, we try not to pull them off because they've established a relationship, and we like to maintain that, and it works better because it helps the overall quality of life for the patient, and our staff like it because they have a consistent place to go.
Right, absolutely. I mean, that sounds like a huge piece. It's almost like a matchmaking progress.
It is, and sometimes most of the time we get it right. Occasionally it's like, I didn't realize I was allergic to dogs, or cats or something like that. I don't think we have anybody that has snakes. That would really, people have volunteered that they're not comfortable with that. So.
Wonderful. Could you walk me through what the hiring process looks like at AmeriCare Medical?
Yes, the process is probably not that different from what other people are accustomed to. It just may be the volume. When we have our applicants come in, we spend a good portion of time conversing with them on the phone, making sure they understand the position, talking about their background, getting an idea on the personality. And then we do a more formal interview, if you will, when they come in for our onboarding. These candidates, they've met this first threshold. They look like there's that potential for them to come in. We start doing some of the background screening, to see any red flags, because obviously they're going to be in someone's home. We treat it as if they were going in one of our family members' homes or in our homes. We want to make sure that they're protected, and then we'll bring them in and go through an onboarding experience with them, and that's where they'll meet some of the other, the coordinating team, establish that relationship, put a face to the name that they will be talking to when they have questions about payroll, things like that. And so that can be a rather drawn-out process. Sometimes we're able to turn around candidates in a couple of days. We have onboardings twice a week. So, and it's not overly large onboarding. So you really have the opportunity to have one-on-one conversations with either myself or the recruiting team or the coordinating team or even the nursing team. So they really, hey, I'd like to do this after I get some experience here. Well, perfect place to do it because we have all aspects of healthcare that people can graduate into without having to look for another employer.
Yeah, absolutely. That's great. Especially since, they're going into people's homes and doing their caregiving services and looking after patients in their own homes. I know I think you touched on this a little bit, but what type of background checks do you conduct for your caregivers?
And it's important that you bring that up, and it's important to recognize how valuable it is to the patients who might not know what goes on behind the scenes. So every applicant is screened for state, local, and federal crimes. Obviously, we check for. It's become common in the last 5-10 years. Social Security fraud, so we make sure that it's a valid Social Security number. We check for sex offenders, any other criminal records. We check for driving records because many times our staff could be driving a patient to a doctor's appointment or something like that. So we want to make sure that they have car insurance, reliable transportation. So that is all done behind the scenes, and that can take a while. That can take, certainly there's a financial piece to that, but it's important. And when I've had staff that say, "Well, why do we have to do something?" I'm reminded of an experience that my wife and I had with our twins shortly after they were born. Started looking for caregivers, and back then it was in a lot of Facebook recommendations and things like that. So we came across someone that had pretty good recommendations from Facebook, and over time, I went to make her a drink one night, and I poured her a drink, and she didn't want it too strong, so I tasted it. It's like, that's not even alcohol in it. So, long story short, this nanny that we hired had drank all of our alcohol.
Oh, wow.
And it was pretty scary when you think about that. Here she is with driving around our twin girls. So that's a perfect example of why using us is going to be a much better proposition than just kind of referring on a neighbor or something else, because the liability falls to us. We're able to do all that heavy lifting and screening and vetting of the candidates because, as I mentioned, we treat them as if they're going in our own home. And then I have that experience, and I think about that anytime somebody says, well, why do we background, that's a pretty high cost. Well, it's a pretty high cost not to.
Right, exactly. That's a great point. When it comes to, we're working with patients and, this is a healthcare field. So with the caregivers going into homes, do you also conduct any type of screening for health conditions?
Yeah, they're all checked for, TB. So everybody has to have a current TB test, and we have a great team that's on people all the time that, hey, your TB test is expiring, and, in 2 months you need to get another one, or your car insurance. Those things are all tracked internally, because the last thing you want to do is introduce another a variable into a health, a health-related variable into a patient's home when they're being treated for something else. So.
Right, yes, that's important for sure. Sounds like there's a lot of moving pieces, but all very important to ensuring, safety of the patient and quality care of the patient. So
yeah, and we've been doing it for 45 years. So I mean, we've got it figured out, but not to the point that we don't stop refining and trying different things. And I think our patients are definitely benefiting. And based on the reviews and the feedback that we get, we feel that we're doing a super job.
Yeah, that's great. Speaking of the reviews that you receive and some things that people may say about working at AmeriCare Medical, what do you think creates retention in your employees at the company?
Well, I mean, I think one of the big advantages is we pay our staff weekly. So that's nice where, if you're used to being paid monthly or maybe once every 2 weeks, it's nice to know that, hey, Friday rolls around, I got another check coming. We also have, benefits. We offer, once the requirements are met, we have a profit sharing plan, for our field staff. I mean, these are not executives. These are, the lifeblood of our organization. So we're offering them benefits. There's health care available to them. I think it's just we're not the size that we can't look at offering things that we get feedback. Hey, what about doing something like this? It's very easy for them to communicate with our team, so it's all text messaging, which I think everybody's probably used to by now. But no, that definitely helps the retention and the variety, because we'll honor a person's request. Hey, I'd like to work on a different patient now, because some of these patients can be, chronic, and it's emotional after a while to know that this person's never going to be able to do what they take for granted. So we're able to put them on different cases to help them recharge and refresh, and that's another way to retain your staff, because if people leave because they don't like the particular case because it's hitting a nerve or something, we don't have to, they can come off of that case, and we're happy to put them on another case.
Yeah, wonderful. That's great. So talking about, just the healthcare industry in general and recruiting and staffing in healthcare, why is it crucial to use the professional services of a home care agency?
Well, we kind of touched on some of those elements with the background. But we take care, and I'll use that term again, the heavy lifting. We work with the doctors regarding the particular orders, or the prescription for the care that's needed. So whether it's therapy, or we have an IV infusion pharmacy, so that can they reach out to that group that's down the hall from my office. We have a medical equipment company where we can get stuff to them immediately. I mean, it's very efficient when you can pick up a phone and talk to us about what your needs might be. Even if you don't end up going with us, we can help. These are some of the questions. These are some of the things that you need to think about. And someone's going in their home, you want to make sure that they're qualified, that they're going to be competent, and that you've got someone that's going to handle any issues that arise. If an issue arises, they reach out to us. They reach out to our on-call person who takes care of an issue. Hey, a health aide was there, noticed that Mrs. So-and-so is having difficulty breathing. Reach out to our nursing staff, and nursing staff will determine whether 911 call, or send one of our nurses out there to take a. So having those resources right there, I just can't imagine anyone wanting to take that load on themselves.
Right.
My mother's 94. I know she won't be listening to this, so I'm not going to say anything that I'll get in trouble for. But that would be difficult for me to do. I mean, other than hearing her call me Danny all the time, when it's like I haven't been Danny for a long time, it's hard to do that. And to take that responsibility on when I can call someone else and still be part of that process, but knowing that my expertise doesn't lie in this area, this is where, let's let the experts handle it.
Right, absolutely. It sounds like it's really important for the family as well as the patient.
Families have to, because otherwise it's 2 full-time jobs for them, and that's hard enough. Mentally, it's difficult because they have to think of, a family member in a situation that may or may not ever change. But this way, at least they know they can leave the house and their mother, brother, father's in good care, and not have to worry about what's going on when they leave.
Absolutely. So is there any advice that you would offer to someone who may be looking to hire a caregiver in their home?
Yeah, I mean, certainly they can they can reach out to AmeriCare Medical. We'd be more than happy to answer questions about the entire experience. Whether, like I said, whether they go with us or not, but certainly talk to, if they haven't already, talk to the doctor and find out, what's the goals of this. That's one of the values of our services. People tend to improve much quicker when they're in a familiar environment, and rather be at home than in a sterile facility and where a lot of other patients are there. This, a little bit more comforting. So if they're contemplating that, think about what they need. Is this going to be short term? Is it going to be long term? Because we can work with we can work for short term, long term. We can work for, couple hours a day, dependent, or just someone that needs a little bit of assistance, or we can have 8-hour-a-day shifts while someone's at work. And so any number of different scenarios we can work with, whether it's through insurance or otherwise, we can accommodate.
Great. Well, thank you for sharing all your insights today, Dan. It's been really, really eye-opening, and it's great to learn more information about the current environment in hiring and healthcare, and a little bit more on the patient side too of what it's like at AmeriCare Medical. Thanks for sharing those insights with us.
Oh, my pleasure.
Yeah, it's been great to have you on the show today.
Thank you.
Thank you for joining us today on AgeWise Health. I'm your host, Madeline Didi. If you have any questions about today's show, please give us a call at 248-288-2270. Stay safe and healthy.